Welcome to the 9th annual community engagement session for the Hazelwood Health Study. For any who don't know me, I'm Michael Abramson and I'm the principal investigator of the Hazelwood Health Study, or at least I have been for the last 9 years. So to commence, I would like to acknowledge and to pay our respects to the elders and traditional owners of the land where our participants and study teams are based, particularly the Gunai peoples of Gippsland. And I would like to say that it has been a privilege to lead the Hazelwood Health Study. We've assembled a very capable team of researchers, and we've had some terrific students and research assistants working with us over the last 9 years. We've, I think, found some fairly important results regarding the impact of the Hazelwood coal mine fire on the health of the Latrobe Valley community. And we are actively trying, with the assistance of the Latrobe Health Assembly, the Latrobe Health Advocate, the regional office of the health department and other relevant stakeholders, to translate those findings and to make a difference to the Latrobe Valley community. I said that I have led the study up until now, and I'm handing over the baton for the 10th year of the contract to Karen Walker-Bone, the head of the Monash Centre of Occupational and Environmental Health. And I'd invite Karen just to give a very brief introduction to herself.
Thank you, Michael, and hello, everybody. First of all, can I take the opportunity to say what a fantastic job Michael has done whilst leading this study, and therefore what a difficult job it is for me to come in and try and fill those enormous shoes. I'm a rheumatologist by training, so a medical doctor, but I've studied health and work issues for over 10 years. I'm very interested in the Hazelwood Health Study and in keeping it going for as long as we possibly can to study all the longer term outcomes. I'm privileged to be part of this study, and I look forward very much to meeting some of you in the future. Thanks, Michael.
Thanks, Karen. And I know that I leave the study in very good hands. So our program today is to have presentations from the various streams that comprise this very complex research program. And towards the end of the session, we'll focus on local impact and community engagement. And then there's the opportunity for those of you in the audience to ask any questions. So without further ado, it's my pleasure to invite Professor Faye Johnston from the Menzies Institute and University of Tasmania to update us on findings from the early life follow-up stream.
Thank you very much, Michael. So I lead the part of the study that's following the health of young people, in fact, those who were in their first 1,000 days of life, starting from conception. So the people we've been following have included mothers who were pregnant during the fire smoke period, the children of those mothers who were not yet born during the fire smoke period, and children who were aged less than 2 at the time of the fire, and another group of children who were conceived and born after the fire, who've been our comparison group. And we've been learning about their health in 2 different ways, these 3 groups of kids. We have a lovely group of volunteer participants who joined us at the beginning of the study, over 500 children who completed a survey. And since then, we've done a lot of follow-up studies of children who've completed surveys, who've come for clinical checks, and some of them even offered blood. And that's the smallest little group analysis we've got, which is the 100 there. But most of our studies have between 100 and 500 children in them. The other stream is a data linkage study that includes all the children who were born in the Latrobe Valley over a 4-year period, including the mine fire. That's totally anonymous. We don't know who they are, but we're able to work out their smoke exposure and look at data like hospital data to find out how they've been travelling in terms of healthcare usage over the years. Okay, so I'm now going to go straight into our results. I'm giving you all of our main results from the study. Where it's highlighted in light green, that's a new result that I haven't yet shared with you in previous years. But just quickly to recap, the health of women who were pregnant at the time of the study, an important thing we found early in the study was that mothers who got exposed to more smoke had a higher chance of developing diabetes in pregnancy than mothers who had less or no smoke. And that was an important finding. It actually translated into around 16 cases that wouldn't have happened otherwise if it wasn't for the smoke. And their children tended to be heavier than children born to mothers with diabetes who didn't get a lot of smoke. So important findings there for diabetes in pregnancy. Okay, so now I'm talking about the group of children who were not yet born at the time of the fire, but their mothers lived through the smoke episode. And in this slide and in the next slide, I'm going sequentially because we've got new findings, but some of them relate to the first few years after the fire. So initially, we did see increased presentations to the emergency department for allergies or skin rash. None of these results were huge, but they were notable. We saw increased prescriptions of steroid medication, also known as prednisolone tablets, in the first 2 years after birth. And these are tablets mostly used for treating usually serious asthma or croup. It's a medication commonly used for allergies and asthma. 3 years after the fire, parents reported an increase in their children having minor respiratory infections diagnosed by their GP in relation to smoke. And we also checked blood vessel growth and development and stiffness, and that was normal. 7 years after the fire, we were able to check lung stiffness. They were too young to check 3 years after the fire, and that was normal at 7 years. We're still waiting for the vascular stiffness results. So this slide relates not to the children who were exposed when their mums were pregnant, but the children who were babies or infants aged less than 2 at the time of fire. And it's a slightly different spectrum of results, similar. In this group, we found a year after the fire, increased antibiotic dispensing to children who were more exposed to smoke than those who weren't. Increases in GP attendances in children who had more smoke exposure, and increased emergency department presentations for respiratory and infectious conditions. And that was all in the first year after the fire. When we looked at antibiotic prescriptions 2 years after the fire, again, we saw increases in prescriptions for antibiotics. 3 years after the fire, when children came to the clinic, we found increases, slightly stiffer blood vessels and slightly stiffer lungs. These were very small effects. We could see them statistically. They weren't effects that were likely to cause symptoms or changes in the health of the children. But the fact that they were there in kids who had more smoke exposure than in other kids told us that there was an impact, that children's bodies did respond to the smoke, and we could measure that 3 years later. The really good news was that 7 years later, that what we found in the lungs had resolved. There was no longer any blood vessel stiffness. And finally, we also looked at the effects of long-term background air pollution in the valley. And this is new and important work because we have found very similar range of outcomes: increased allergic sensitization to dust, increased GP attendances, increased antibiotic dispensing, increased attendances at hospital emergency departments, and hospital admissions for respiratory conditions and infections. And this hasn't been to a huge severe episode. This is in children who live in parts of the valley where there's slightly more air pollution in the background due to traffic or due to power station emissions than children where there's slightly less. And it tells us that ongoing everyday exposure is also important for children's health, and tells us that that's also an area for action to protect health. So what does this mean? And I guess the lessons from the ELF study so far are that it's important to protect against both severe extended smoke events, mine fires, peat fires, severe bushfires, in various ways: access to cleaner air, home infiltration, relocation if necessary, if it's going to be a long event. And it's also important to protect children's health with everyday air quality. And that's things that will be useful, using an externally vented range hood if you've got a gas cooker, not smoking around kids, even avoiding busy road if you've got a routine commute or exercise or walk you do. These little actions can have quite a profound protective effect on health going forwards. And I guess the final message is that for all these conditions, air pollution is only one of a whole lot of risk factors. It's a contributor. It's not generally the main cause. So the other important lesson is that effort and support in health generally, maternal and child care, antenatal care, young families, is just as important for protecting health, because you can't always avoid smoke events, but if you have the best possible care and start to life, you can manage them a lot better. So thank you. That's all from me.
Thanks very much, Faye. It's now my pleasure to introduce Bridget Borg, who's the head of the Lung Function Laboratory at the Alfred Hospital, and in her spare time leads our adult respiratory stream. Over to you, Bridget.
Thanks, Michael. So recently, the respiratory adult stream has been doing round 3 of clinical visits. So we have a lovely cohort of adult volunteers from both Morwell and Sale who have agreed to come and have some lung function assessments, answer some respiratory questionnaires, and this year specifically with round 3 have also agreed to do some blood tests so that we can understand better the prevalence of COVID-19 infection in the region. These photos here show a couple of our participants who agreed to have some photos tested so that you can see the type of tests that are involved with the clinical visits. In terms of numbers attending each round of testing, you'll see that there has been a drop-off as we've progressed from time 0 from when the mine fire occurred. So in round 1 back in 2017-18, we had a total of 519 participants attend. Round 2 in 2021 was impacted by COVID and we had a fall in numbers, but still did really well considering all of the challenges that we faced, and we had 329 participants attend. And hopefully by the end of round 3, we will have had about 250 participants come back for a 3rd round of testing. In terms of some of the results, we're still doing some data analysis around round 1 data, and Tom McCrabb has written a paper that's currently under review with a journal looking at multi-breath washout. Now, multi-breath washout tells us about gas mixing in the lungs, how even it is across the lungs. And it may give us some information about early airway changes that can't be seen with more common tests of lung function, such as spirometry. And what we found was an association between increasing exposure to coal mine fire smoke, related PM2.5, and an uneven gas mixing in the conducting or larger airways and you can see the conducting airways in the diagram that's to the right of your screen. And this may reflect airway inflammation in the conducting airways 4.5 years after exposure to mine fire smoke. We currently are doing some analysis comparing the results of round 2 to round 1 data. So just to recap, in round 1, we found that exposure to increasing levels of mine fire smoke was associated with less stretchy lungs, a higher prevalence of COPD, like lung function in non-smokers. So COPD is chronic obstructive pulmonary disease, and we found a higher proportion of lung function that looked like it might be COPD-like in non-smokers. Worse asthma control in those who have asthma, and uneven ventilation or less efficient gas mixing in the larger airways. And this particular test wasn't repeated in round 2. In terms of round 2 results, we haven't finalised the analysis yet, but early findings suggest that the exposure to increasing levels of mine fire smoke may no longer be associated with the changes that we saw in round one. So it may be that there's been some recovery of lung changes that we saw in round one. But like I said, this is early data and is incomplete as yet. Also from round two, we looked at exhaled nitric oxide, and Sarah Kress has submitted a letter to be published in a medical journal. So the level of nitric oxide in exhaled breath can provide information about inflammation of the airways, and specifically allergic type airway inflammation. So in round two, we measured the level of exhaled nitric oxide in our entire participant population, but we found no association between increasing exposure to mine fire smoke and exhaled nitric oxide level in the cohort as a whole, or even when we looked at more vulnerable groups such as those with self-reported asthma or chronic obstructive pulmonary disease. So what are our future plans? Well, we conclude round three data collection at the end of next week down in Sale. And so in 2024, we look forward to completing all the data analysis and writing up of the outstanding data from round one, round two, and then looking at the data from round three. And you'll see four very happy looking scientists in this last slide. I would like to acknowledge Hazel Hartley, who was the coordinator for the early part of round three, but now has moved on to greener pastures. Bella and Jackie, who have done the bulk of the testing down in Morwell and Sale, and also Thomas McCrabb, who has been fabulous with getting Bella trained up, but then also doing some cover down in Gippsland with the absence of Bella and Jackie over the data collection period. Also like to really acknowledge all of those from Hazelwood Health Study who work very hard in the background with recruitment of participants, helping us with bookings, with all the logistics and getting us set up and moved between sites. Thank you.
Thanks very much, Bridget. It's now my pleasure to introduce Tyler Lane, who's a Senior Research Fellow working on the Hazelwood Health Study, and he'll update you with the latest findings of our adult survey.
Thanks very much, Michael. So the updates I'm going to provide today are from a follow-up that we conducted with the original cohort. So from the 4,000 people who were originally surveyed in 2016 and 2017, we followed up with 612 in 2022. So about 8 or 9 years after the mine fire itself. And there are two real focuses here. The first was long-term respiratory health. Whether the smoke exposure from the mine fire had long-term effects, and also whether the emerging COVID-19 pandemic may have exacerbated effects, or the smoke from the fire made people more vulnerable to COVID. We also wanted to look at any protective effects of things like diet. So the survey addressed these three broad topics, and I'll speak to each one of those today. The first question we wanted to address was the long-term risk of respiratory symptoms as it relates to smoke exposure. So this is divided into the initial survey. So what differences did we see at 2016, 2017, so 2 to 3 years after the fire, in respiratory symptom prevalence? And then at the 2022 survey, whether there were changes from that initial difference. And what we found at the initial survey was that chronic cough, current wheeze, and chest tightness were all higher in prevalence among those with smoke exposure. But when we look at the follow-up survey, we see something pretty interesting, and that's chronic cough. Prevalence has worsened as a result, or sorry, not as a result. We can't say that for certain, but in association with smoke exposure. So that means there was a higher prevalence of chronic cough 2 to 3 years after the mine fire as in association with smoke exposure, and that got even worse 8 to 9 years later. And we also see some evidence, it wasn't quite as certain, so we can't say it with as much strength, but some evidence that current wheeze also worsened as a result of smoke exposure. So this is a bit concerning because chronic cough is quite a serious health condition. It's associated with deterioration in physical, social, and psychological health. So it's something that we probably want to keep an eye on. The next question in this study that we wanted to address was whether having a history of COVID-19 after smoke exposure uh, increased the prevalence of, or sorry, worsened the effect of smoke exposure. So when we look at people with no history of COVID-19, we see that chronic cough, higher prevalence in association with smoke exposure, same with current wheeze. But when we look at people who reported a history of COVID-19, so this isn't having COVID at the time of survey, but at any point from the start of the pandemic, there was evidence that chronic cough and current wheeze was associated with smoke exposure. So smoke exposure was still increasing the prevalence of those, but some other symptoms were emerging, most notably nocturnal shortness of breath, chronic phlegm, and possibly chest tightness. So this is telling us that after smoke exposure, developing or contracting COVID may make it more likely that smoke causes some of these respiratory symptoms. So we're seeing a convergence of two public health threats. First, smoke exposure from landscape fires, coal mine fires, and respiratory and viral pandemics. So again, another emerging concern that the two are making each other worse. The next question was whether smoke exposure makes it more likely that you can contract COVID. We've done a review leading into this to see that there is actual considerable evidence linking air pollution to COVID-19, specifically the particulate matter air pollution seems to make people more vulnerable. But that's all looking at background air pollution where you have chronic long-term exposures. Question for us was, if you have an extreme but medium duration exposure many years in the past, did that make you more vulnerable to contracting COVID and having severe disease when the pandemic emerged? And what we found was that smoke exposure was associated with COVID-19, but we can't say with certainty that the association existed. So what I'm saying is there was a positive association, but not strong enough to say certainly, yes, there was an association, definitely. And when it comes to severity, because there is evidence linking air pollution to severe COVID disease, only 1% of our sample reported any sort of hospitalization, which was our marker for severity. So we couldn't do any reasonable analysis there to determine whether smoke exposure increased the likelihood of severe COVID-19. In conclusion, we can't really say much with great certainty about these results, other than there's still enough evidence to treat the association as real because the consequences would be so dire. No one wants to contract COVID or have a severe infection, and there are many reasons to avoid smoke exposure as it is. Finally, the third question is still underway in analysis. The paper is almost complete. This is looking again at whether diet offers any protection against the effects of smoke exposure. So the results are still emerging and preliminary. We're not seeing a terrible amount there, though there might be some protective effect of fruit consumption. And what I mean by that is if you've had smoke exposure but also have higher fruit consumption, it seems that there's a lower prevalence of chronic cough. And now I'll speak a bit about the Hazelwood arm of the study. This is led by Yuming Guo, but I'll just be talking about what we've done since the last meeting. Bit of background on Hazelwood. There are two main arms of that. The first is a health record linkage. This takes the survey I was just speaking about and links that to hospital records, ambulance records, and the Victorian Cancer Registry to try to make broader inferences using public health data. And this is able to use some of the sociological data that's collected in the surveys, along with more precise estimates of smoke exposure, because we can place people during the mine fire roughly and combine that with modeled estimates of air pollution from the mine fire. The other arm of Hazelwood is using anonymous data extracts. So this doesn't have that sociological data or the precise smoke exposure indicators, but we can see where people were living and make broad inferences about their exposure. So if they lived in Morwell, they probably had more exposure to mine fire. If they lived in the rest of the Latrobe Valley, still some exposure, but lower, etc. We only have one study that's been published to speak about today, and that's looking at emergency presentations as they relate to smoke exposure. So this is from the linkage study, taking people who were part of that survey and combining it with Victorian emergency minimum data set. And for this, we had 2,025 people, and we were looking in the first 5 years post-mine fire. So we were comparing people in Morwell, who again had the most exposure, to those in Sale, who had very little or minimal exposure. And what we see is an increase in respiratory conditions in that 5-year period, but not much else really emerged. However, when we broke that 5-year follow-up period into 2 chunks of 2.5-year periods, we see that cardiovascular disease emergency department presentations increased, and then they subsided in the next 2.5 years. And this comports with a number of other of our Hazelwood Health studies, finding that the effects of smoke exposure on cardiovascular problems was really immediate and short term. So there was unfortunately an increase in cardiovascular related deaths shortly after and during the fire, more than we would have expected anyway. And not much else has been observed afterwards. So with the subsiding, it might be that there was some what we might call a harvesting effect. Those who were most vulnerable unfortunately faced the most consequences in the immediate aftermath. And that meant those who had exposure were less vulnerable on the whole than those who had less exposure, if you will. And we do have a number of studies in the pipeline. The first is looking at whether smoke exposure was associated with the development of new cancers. That is nearly complete. The results are quite preliminary, but it's really not showing much. This might be because we just haven't had enough follow-up period to make any strong inferences or detect any effect if there is one. Same thing with survival among those who already had cancers. The analysis is pretty well complete, and it's showing, again, not really much. I don't think we'll need much more follow-up to make any more inferences about that, though. I think that question may be well answered by that study. We also have a study looking at long-term hospital emergency and ambulance use. That's nearly finished. It's quite complicated, so I can't really give any preliminary summaries of what we're seeing so far. And then a study that's in the planning stages is looking at major adverse cardiovascular events. This is heart attacks, strokes, cardiovascular related deaths in the aftermath. So we might see that the most extreme outcomes may still be affected by the smoke exposure. But again, this one is still in the planning stages. Thanks very much.
Thanks, Tyler. It's now my pleasure to introduce Sue Yell from Federation University to bring us up to date with the latest findings from the Community Wellbeing Stream. Over to you, Sue.
Thanks, Michael. The Community Wellbeing Stream has been tracking community wellbeing and recovery in Latrobe, and our initial focus was on the impact of the Hazelwood mine fire, including the impact on older people. But for the last few years, our research has broadened to look at a range of factors and events impacting community wellbeing. And a lot has happened since 2014. We've had the closure of Hazelwood, we've had Black Summer, smoke, we've had COVID, as well as the creation of the Latrobe Valley Authority, the Health Assembly, the appointment of the health advocate, among other significant things to happen in the valley. So we're looking at all of those types of things. We're also supporting the work of the psychological impact stream using surveys and interviews to explore the relation between community wellbeing and individual wellbeing. Our work on community wellbeing includes both subjective and objective aspects. So by that, I mean we're interested both in how the community perceives itself and also what statistics predict about community wellbeing. To understand how the community perceives itself in 2020, we conducted interviews with 30 community members and stakeholders. And then earlier this year, our research assistant, Larissa Walker, again interviewed 30 people to see if there'd been any changes in community wellbeing since 2020. And we're still looking at those, analysing those findings, those results. We're also monitoring the topics that crop up in local media and social media groups as another lens on what's happening in the community and the issues which cause concern or maybe inspire pride and positivity. The stream's also been working on a community wellbeing barometer, and this is a tool to measure community wellbeing using statistics taken from publicly available data sources like the census and also the type of data that Vic Health collects. It looks at, the barometer that is, looks at things like access to health services, employment figures, rates of voluntary work, crime figures, cost of living measures, and life satisfaction, just to name a few. So this is a graphic that we call the donut graphic, showing what we're looking at in the Community Wellbeing Barometer. We discussed the design of the barometer with our interviewees, and we also conducted a review of other published research that has looked at similar types of tools. So we've chosen 5 key areas that impact on community wellbeing based on what we learnt from the literature and from our interviewees. And these are services and infrastructure in the pale blue, social connections in the yellow segment, environment in the pale green, the economy in the darker green, and health in the darker blue. And we've then broken down each area into a number of sort of related themes and looked for measures that can, so that's where we look for the statistics that can speak to changes in each of these themes over time. Maybe they stay the same, maybe they improve, or maybe they get worse. In November last year, we presented the barometer to key stakeholders, and based on what they told us, we made some adjustments. And we're currently inputting data and analysing the revised results from that. Then we'll use it to map the community's wellbeing and resilience against significant events like Black Summer, like COVID. Now that we've finished collecting all our data, we'll consider what we've learned about the community's wellbeing from all those data sources, the interviews, the barometer results, the media and social media data, and the surveys. We hope to gain insights into what makes this community resilient, as well as its areas of vulnerability. We'll also continue to look at impacts on older people and what we can learn from our elders. Age is continuing to be one of the key factors considered in the analysis arising from the other stream areas. So we're kind of, working with other streams to look at those issues. In the coming months, we'll finish analysing our data, write up reports in order to share our work more widely. And we'll share the barometer tool with any interested groups. And we hope to look for further funding to make it usable and accessible to others. And we also hope to continue working with stakeholders in La Trobe and more widely to better understand community wellbeing in a time of rapid change and transition. And that's it from the Community Wellbeing stream.
Thanks a lot, Sue. So without further ado, I'll call on Tim Campbell, who's a research fellow in the School of Rural Health, to update us on the latest findings from the psychological impact stream.
Thanks, Michael. And yeah, an acknowledgement to everybody who's on the team there on the first page. So what have we been up to recently in the psychological impact stream? We've had 2 main points of focus in the stream over the previous 12 months. So we've completed some further reporting from the various surveys and analyses that we'd undertaken across both our adult and school study branches of research. And in 2022, we also conducted a third round survey of the mental health of adults in Morwell, as well as a survey of parents of children in the ELF cohort, both of which we're in the first stages of analysing. So recent findings, following on from the previous slide, over the last 12 months, we've published 4 papers, 2 which stem from our 2020 adult mental health survey and 2 from our school study. I'll only briefly summarise the findings on these papers today because we've presented on them before in previous years' engagement sessions. That also gives you a bit of an insight into the sometimes stretched out timelines involved in research reaching final publication. The 2 school study papers collectively, they demonstrate that Morwell students were susceptible to experiencing typically moderate levels of post-traumatic stress after the mine fire. And they also demonstrate that the disruptions that were caused to schooling, caused to schooling by the event had a detrimental impact on NAPLAN performance that was across year levels and also across learning domains in Morwell schools. And what we also found in those studies were that that recovery from that disruption was still ongoing several years later. The adult mental health papers report firstly on a relationship we found between post-traumatic stress levels related to the mine fire and somatic symptoms. Somatic symptoms are unexplained physical complaints. And that finding is useful because it draws attention to how post-traumatic stress can be an underlying factor in the health issues that people present with at, for instance, GP clinics, and that post-traumatic stress needs to be considered when those physical complaints are being investigated. The second adult mental health paper demonstrates how socio-demographic factors shaped long-term post-traumatic stress responses to the mine fire, including how life circumstances such as socio-economic disadvantage, physical and mental health conditions, and recent exposure to other stressful life experiences tended to render people susceptible to both chronic post-traumatic stress trajectories and also to late onset post-traumatic stress trajectories after the mine fire. And the paper also demonstrates how converse circumstances such as having social support and having socioeconomic advantage contributes to resilient responses as well. And then finally, in collaboration with the Community Wellbeing Stream, we're also in the final stages of completing a paper investigating Morwell residents' perspectives on community wellbeing after the mine fire and how these two are related to socio-demographic circumstances. So as mentioned previously, in the middle of last year, we surveyed 226 parents of 260 children who participate in the ELF cohort. And this survey will enable us to investigate how parental mental health and family functioning contributes to the various child health and wellbeing outcomes we've been assessing across the Hazelwood Health Study. In that survey, we administered a variety of assessments of mental health and wellbeing of both the parents and their children, and we also investigated family-wide issues and added some assessments of concerns related to the 2020 bushfire season and the COVID-19 pandemic, so that we'd be able to account for the impacts of those events in our research. We're currently in the initial stages of analysing the survey data, but we anticipate that first results won't be too far away. Likewise, we also conducted a third round survey of Morwell adults' mental health later in 2022, and that will enable us to conduct a truly longitudinal analysis of post-traumatic stress outcomes, which will span some 8 years since the mine fire. In that survey, we also assessed post-traumatic growth for the first time, and we again included assessments of concerns in relation to the 2020 bushfire season and the pandemic, particularly as these types of events might be trigger points for post-traumatic stress symptoms to emerge. As you can hopefully see in the table, we had another very good turnout for the survey, which is important for our analyses and for being able to draw reliable conclusions from them. And so we would like to particularly acknowledge and thank everyone in the community who's committed themselves to continuing to complete the various surveys we've sent out over the years. So finally, future plans. Our plans for the next 12 months in the psychological impact streams are to complete those analyses stemming from the recent surveys that I've presented, and to begin reporting those findings. We'll also be resurveying parents of children in the ELF cohort in early 2024 to continue our family-focused branch of research.
Thanks, Tim. And Tim made a really important point, which I should have made at the outset, and that is that none of this would have been possible without the support of the local community. So a big thank you to everybody who's participated in any of the streams of research. Well, Matthew Carroll probably needs no introduction. He's a Senior Research Fellow in the School of Rural Health and Co-Principal Investigator for Gippsland. So please tell us about the local outcomes and community engagement, Matthew.
Thank you, Michael. Okay, so the key outcomes in the past year, as I always say, it's important that we're still reporting on the short and long-term impacts from the mine fire, and it's really interesting to see that we're growing the evidence base to inform responses to future events. And I was really pleased to see in Faye's presentation for the ELF child development stream that there's clear recommendations coming out now about protecting pregnant mothers and babies and young children from extended smoke events. It's really interesting to see the work that Tyler was talking about, where we're actually looking further than our original research plan to look at the intersection with other key factors like COVID-19 and so on. And it's great to see what Tim's talking about with the psych stream, that we're also taking that into consideration in our surveys, and that analysis will be coming out for the next meeting. So it's really good to see the study is able to go a bit broader. And I'm pleased to see the reassuring findings that are starting to come through from the adult respiratory and ELF clinical assessments, that some of the early findings seen in the 2017 assessments may have resolved in the second round in 2021, and really keen to see what's coming in the rounds that are happening right now. So if people have been invited by the ELF stream or the adult respiratory stream to come in for clinical assessments, we really encourage you to take up that opportunity in the next couple of weeks before those assessments finish. I can also report on one unexpected outcome, that we had a phone call only last week where we were talking to a participant in the adult respiratory stream about coming into the next round, and she mentioned that the abnormal results that we sent her following her round 2 assessment, she quite appropriately took to her GP, and that prompted further assessment, which resulted in a diagnosis of lung cancer. So clearly that was good for her to get that earlier diagnosis. And it really highlights the value of major studies like this, monitoring health over time, that it's important for individuals as well as for the wider community. Right, now where to next? We have an initial 10-year research program. We're coming up very close to the end of our 9th year, so 1 year still left on the books, and we really need to make sure that our findings are being used to improve the health and well-being of the local community. So that means lots of conversations. We're really keen to come out and talk to interested groups, health and community groups, obviously, but more importantly, I think the local community groups that we need to come to you rather than ask people to come to us. And I'd like here to actually really highlight the work that Diane's been doing within our Latrobe Health Assembly subgroup, where they're giving us input from the community. So Diane will be coming up on the Q&A, has really been spearheading discussions with the emergency management planning people, both locally and regionally, about trying to ensure that our findings inform community responses and emergency responses to any future smoke events. So that's a really great and important job that Diane's been doing for us. But if you've got suggestions about groups we should come and speak to, about research topics that you want us to take on going forwards, please let us know. We're planning a major event next year where we'll be inviting community and researchers to come together to look at all of our findings and other related findings and talk about research directions, both within, hopefully, the longer Hazelwood study, but in other research proposals. So please send emails to us at the contact@hazelwoodhealthstudy.org.au address so that we know where we need to go. Jill, over to you.
Thanks, Matthew. And again, just encouraging anybody in the audience to go to the Q&A function, which you should be able to see on my screen. It's at the bottom of the screen. It might be in a different place if you're on an app on your phone. But we do have a couple of questions come through. And thank you, Lorraine, who asked a question about how we identify and access the data of people who have died. And I'm just going to throw that one over to Tyler, who has been looking after the Hazelwood aspect of the study for us.
Yeah, thanks, Lorraine. So death is included in a number of the health data sets. So if someone dies in hospital, it'll be indicated there. The Victorian Cancer Registry also is linked to the National Death Index, and so they get dates and causes of death. It does take a while for the National Death Index to from the date of death to catch up with the actual causes, usually about 1.5 years to fill in that data. And just recently, we've acquired an extract of the National Death Index that we can link to our survey responses, so we can actually get that information direct ourselves. So it really comes from a number of data sets. And one of the advantages of using the National Death Index is it captures everybody. Hospital data only captures those who died in hospital. Ambulance data may only capture those who died once the ambos arrived, etc. Thanks.
Yeah, I can just add to that, Tyler, that just to clarify, so we have our identified cohort of people who have participated and provided us with their names and personal identifiers. And we have consent from the majority of those people to allow us to link to the National Death Index in the future so that we can look at the pattern of death in that population, and for a population of people who we have a lot of information about their risk factors, such as their smoking status. And then we have a de-identified cohort where we've collected sort of really like the pattern of death information for the whole population of the Latrobe Valley and the broader Gippsland area. And we've been able to compare that over time with the rest of Victoria to see whether there's any change in pattern in deaths following the mine fire relative to other parts of the state. But for that part, we don't have those people's identifiers. We really just have like anonymous cases of death, and we're just looking for changes in the pattern. So we have another question in regards to the early life follow-up stream. So that's a question for Faye, and it's really whether we know anything about why the prevalence of diabetes might be higher in pregnant women who were exposed to the mine fire smoke compared with pregnant women who were not.
Thanks, Jill. So what I would say there, this finding often surprises people, and over the last decade or so, there's been a huge increase in research on associations with air pollution. Initially, most research focused on lung health, then heart health. And over the last 10 years, a lot of evidence has come in, and we now know that ordinary background air pollution, in big cities, for example, we know that's associated with rates of diabetes in the community. So the higher the levels of air pollution, the more people are likely to develop diabetes. Diabetes has a lot of risk factors, of course, genetic and environmental. We also know short-term fluctuations in air pollution influence short-term levels of blood glucose. So we know there's a link. When you breathe in air pollution, it sets off reactions, immune responses, stress responses. A part of those stress responses include increased stress hormones, and that's possibly the pathway by which there's also increased blood glucose. So in this study, we got a severe episode. It was time limited, but it does fit. So it was one of the first studies ever globally that showed this link with an episode. There's since been studies of wildfires similarly with episodes that have also shown an increase in diabetes during pregnancy, because in pregnancy you're more vulnerable. Pregnant women get tested for diabetes. Just the fact of being pregnant puts you at higher risk for a lesser ability to deal with the blood with glucose you eat. That's probably a long enough answer.
Thanks, Faye. And just looking across the panel, I think, Jane, you had a question in regard to what is coming up as the 10-year anniversary of since the mine fire.
Yeah, thanks very much, Jill. And it's a question probably for either of Tim, Sue, or Matthew. But I just know from hearing from people in the community, they're conscious that next year is the 10-year anniversary of the mine fire. And naturally, that brings up levels of anxiety. And I'm just wondering if there are any learnings that we have from the studies to date that can help us best prepare our community next year.
Yeah, Jane, it's not something we've actively thought about yet, but it is something we do need to think about. We know that a lot of people get a lot of reminders about that, and as we said last year in some of the work that Tim was reporting on in terms of the increase in post-traumatic stress, reminders of events can actually make people more stressed. So we do need to do it in a very careful way, but it is something I think we all need to work with you and with the Assembly to make sure that we acknowledge the anniversary and we invite people to think more about it, but not to the point that it distresses them and upsets them.
Could I add to that, Matthew? Yeah. Thanks for the question, Jane. My just thinking about it, off the top of my head, I guess, is that it would be an opportunity, I guess, to acknowledge some of the significant things that have happened that have been positives because the mine fire happened. So rather than necessarily focusing on the negatives, the fact that this study has occurred and that we've learnt an awful lot about how to minimise or avoid some of the negative impacts of smoke on health, and also to acknowledge the community activism and agency that and growth in community empowerment and voice that's occurred since then. And I guess just as a side contribution, we have the full set of photographic images that were developed for the photographic exhibition, Our Hopes for the Future of Morwell, which was one of the community wellbeing stream activities around resilience and recovery. So maybe it's an opportunity also to bring that out and re-exhibit it if there is to be some kind of marking of the event. That might be appropriate.
Thanks, Sue. Another question that has come up in the Q&A, thank you, was a question about the person who was found to have lung cancer and whether they were aware that they had that health issue before arriving at our respiratory clinic, and whether we have future plans for investigating cancer in our cohort.
Maybe I could respond, Jill. And that is that what I've been told, this person didn't know that they might have lung cancer. Now, the tests that we've been doing are not terribly specific for lung cancer. They're more directed towards detecting airways disease. However, we are currently thinking about further research, and the Commonwealth Government recently announced the introduction of screening for lung cancer involving low-dose CT scans. So that's being rolled out across the country, and I think this is an opportunity to work with the Latrobe Valley community to ensure that the best possible screening service is implemented. And of course, we have really good smoking data, and this is one of the difficulties with the proposed national scheme. It can't be based solely on sex, so as the screening has been for breast cancer or cervical cancer, and it can't be based solely on age, as the screening for colorectal cancer has been. It also needs to take people's smoking history into account. So the hope is that that can be done through general practice. But I think we're in a very good position to influence the development of lung cancer screening in the Latrobe Valley and ensure that it's effective for that community.
Thanks, Michael. We are almost out of time. Sorry, Tyler, did you want to jump in there?
So I was just thinking about some of the plausibility. This led to a bit of a discussion internally as to whether that could actually be related. And of course, we could never attribute that exposure to certain outcome like that. But it did cause me to look up some of the World Trade Center 9/11 attack information to see what they consider a plausible lag time, because how long does it take between an exposure and an outcome before we can make some inferences about their relationship? And interestingly, the World Trade Center Health Agency, I believe it is, has a 4-year lag between World Trade Center and the emergence of solid tumors like lung cancer before they can even consider it something that is could be related to the World Trade Center exposures. Just a little bit of context there. Again, it's hard to make that direct causal link between that exposure and the lung cancer in this case.
Thanks, Tyler. Well, I think we have come to the end of our time. I just want to thank everybody for participating and thank all of our audience participants. We do have a very comprehensive website where we have really substantial resources there that describe all of the study's findings over the previous 9 years. And that includes lay language research summaries as well as more technical scientific documents. So hazelwoodhealthstudy.org.au is the website destination to go to. And you can find contact details for us there to get in touch with us at any time with any questions that you might have about the study. We are still out there working hard to answer as many questions about the impacts of the Hazelwood mine fire on the health of the community as possible. Thanks, everybody.